A Ventouse delivery is an assisted delivery, usually done by a doctor, although in some hospitals it's done by a midwife, whereby there is a delay in the labour and the woman who's having her baby is unable to push the baby out, either because she's exhausted or because the baby's not in quite the right position, or perhaps the baby itself is becoming tired and it's the medical and midwifery opinion that the baby needs to be delivered so that it can be resuscitated or just breathe outside of mum's tummy. So this is a standard ventouse, and this would be squeezed, passed into the vagina, allowed to open, and it would go against the baby's head. We'd attach a tubing here and suck the air in the cup out of the cup, and this would make a seal against baby's head. And then when mum pushes, the obstetrician or midwife can help guide the head across the perineum and out into the world. And in fact, most of the force comes from mum, and it's more of a direction thing that this is used for. Another one which is used is this one. Now this one isn't made of plastic, it's made out of metal, and this one is used where a baby's head is not in the right position, and this can be attached further round the baby's head and then pulled by a chain that just allows the head to then be brought into the right position and then delivered. And whilst I realise that sounds very scary, and I could imagine people sitting at home thinking they wouldn't want that inserted into their vagina, compared to the size of the head and compared to the dilation and stretching that's already gone in the second stage of labour, in fact it's actually very well tolerated by women, very well indeed, surprisingly.
Caroline had a difficult ventouse delivery with her first child, Oliver.
She got the ventouse and forceps out and then started pulling me and the bed across the room. And after an hour of this, I only know it's an hour from my notes, in comes Dr. Kildare from ER, this gorgeous consultant called Mark. See, I remember this really well. He was absolutely lovely.
Good time.
Walked in the room and it was like guardian angel walking in, and I felt saying to this woman, get out from between my legs, you are useless, just move. So she moved out the way, and this guy just said, come on, we've got to get him out on the next push.
And so many things can make a difference. If you've got a doctor who is woman-friendly and is happy and jolly and talking to the woman and being friendly, it can make it, and doing a ventouse, it can be so different than the practitioner who just walks in and with a solemn face and just does his job and congratulations and walks out.
Unlike the other two, it doesn't need to be attached to a pump to generate the pressure. The pressure is generated by pumping this handle here, so it's a small device. The general principle of using the ventouse would be you attach it to the baby's head, you get the mum to push, you guide the baby's head down, and exactly as with a normal delivery, an unassisted delivery, either the perineum will stretch to allow the baby's head to come through, or it won't. And if it doesn't, then that can be an indication for an episiotomy. But the instrument itself is not an indication.
Obviously no woman goes into childbirth saying, hey, Whooshy, I hope I have a ventouse. So obviously it's always going to be something that they didn't want. But you need to be able to turn a birth plan that hasn't been achieved into a positive experience, and you can do that by the frills, by making sure there are still the frills. You know, if a woman has to have a ventouse, yes, she can still maybe achieve her physiological third stage, still achieve skin-to-skin contact and with her baby instantly. Just because one intervention needs to happen, it doesn't mean to say that all the other interventions have to happen.